When I got diagnosed, I had a 7-year-old son and a 14-year-old daughter, and it was my worst nightmare. I was first introduced to such a disease by losing my father when I was 7 years old. He was battling lymphoma. And then unfortunately, 5 years later, I lost my mother to pancreatic cancer. But when I was 34, I didn't feel well and I didn't know what was wrong. And I eventually did a self-check and found a tumor. Your body kind of goes through some sort of shock at the realization when you're diagnosed, where your mindset changes from what's wrong with me, I'm sick, I don't feel good, to I'm on a mission. I have an illness and I need treatment. I need a plan and I need to find the best doctor there is. During chemotherapy, a lot of people lose their hair, and I was no exception. I was in the shower shampooing and I noticed some hair coming out of my hands. So after the shower, I walked out into the kitchen with a buzzer and I had my daughter and my son shave my head. And it was a therapeutic, to be active in the fight. I'm very happy that I had that support system and that my wife and my children supported me during such a terrible transition. I found after 3 rounds of chemo that I could barely stand up on my own, and it was such a relief to have, again, the support system of so many great providers or so many great family members, community members helping you stand. I'm very thankful for the doctors, the surgeons, the nurses, the janitors, the cafeteria workers, everyone who participated in my care. I'm very thankful for them. Dr. Sperry was very concerned in the pre-surgery room about the scar he would leave on my neck, and I wasn't very concerned about it, so I just told him that I'd tell my son that I got in a knife fight with a ninja. It worked. He bought it. I'm currently 2 years cancer-free, and after such a great experience at the University of Iowa Hospitals and Clinics, my wife and I decided that we wanted to move from Waverly to this area so that we could work for the university. Even in HCIS, we work in a different building than the main hospital. We do believe in the excellence every time mentality. We do know that we are changing lives. We know that we are changing medicine. Maybe not on the front lines, but at least we have some capacity to help, and that's comforting to me as a past patient and a current employee. When someone is seeking treatment, it's one thing to get medical help, and it's yet another to get a feeling of compassion and care. And that's really the difference in the University of Iowa Hospitals and Clinics, is that you're not just getting treatment. You are a friend or a family member who's getting helped by truly compassionate people, to make attachments to people who are deathly ill. I think it takes a lot of strength and a lot of emotional resilience to be able to do that, and that they shared that with me was such a wonderful thing. What a wonderful gift.